I believe euthanasia should not be legalized, since it's not only difficult to define the criteria for conducting euthanasia, but also hard to guarantee that the patients made this decision voluntarily. So overall, the cons is greater than the pros. Euthanasia is referred as assisted suicide, which is used to terminate the patient's life when the patient is suffering from incurable and painful disease or in an irreversible coma. It's usually conducted by the doctor administering a lethal drug directly. We can easily find documentaries online, such as The Suicide Tourist, recording stories of brave men who choose euthanasia at the end of their lives. I can strongly resonate their feelings and respect their choice. Euthanasia is indeed needed for some patients who no longer want to suffer from the endless torture and just eager to get relieved as soon as possible. That makes perfect sense. And according to the autonomy arguments, the patron of dignity in dying, Patrick Stewart said, we have no control over how we write this world, but at the end of life, we would have control over how we live it. He had a good heart to help the community for sure. However, this idea becomes much more complex when it comes to the implementation. First of all, personal will is always emphasized under this topic. However, the patient's voluntariness is always determined by other factors that the patients have no control of. What the law protects is never the right to choose for the powerful community, but the right not to choose for the weak. Sometimes the true reason for patients to choose euthanasia is not to become a burden. Medical bill could drain a family's savings easily, but still cannot save the patient from death. Even like everything the money can buy, it's only a small hope with no guarantee. It's not worthy to do so for families in financial difficulties. However, they just cannot give up their family members emotionally. So to prevent this tragedy from happening, the patient is forced to voluntarily give up his life under great mental pressure. Like that's really ridiculous. At this time, the right to die becomes the responsibility to die. Think about it. It's horrible. Like since the terminal patients, like if a terminal patient still wants treatment regardless of his family's financial status, or he maybe you want the support from the society, he wants to raise up money, raise up funds to cure his disease, he may be deemed to be selfish and would receive tons of condemn from the public. Did he do anything wrong? No, he just wanted to live. And moreover, a survey published by British Medical Journal in 2011 found that not all people who have incurable disease would like to receive this kind of assisted suicide. Majority of the 168 patients of the French Association for Locked-in Syndrome who are almost completely paralyzed but fully conscious would like to continue enjoy their beautiful lives. They still have a lot of things to do. Like they can think, they can read, they can communicate with the other people, right? And secondly, it's extremely difficult to define the criteria satisfying the euthanasia. It's hard to know if the patient reaches his last stage of life. We all have seen miracles of terminal cancer get recovered with constant treatments, or it's totally possible for the patients to live with the tumor under control over 10 or more years. Miracles are totally unpredictable, but we can never deny its possibility. For instance, the doctor once claimed that Michael Schumacher has few chances to wake up from the vegetable status, but his wife never gave up no matter what happens, and finally had Michael back after years of efforts. If a euthanasia was conducted, we would have lost the king of F1 forever. On the other hand, the doctor may determine the patients could be saved with timely treatment. Yet the patients refuse to do so, like refuse to cooperate with the doctor, which made him reach the threshold of euthanasia deliberately. At this time, should the doctor execute euthanasia for him to facilitate his suicide? That's a problem. In some patients, like there are some patients truly need to euthanasia, but the rest may be forced to make this decision. Even with the most detailed criteria, we still cannot fully appreciate them. Since it is the doctor, the human is making decision instead of a machine. The doctor may reference the patient's family's opinion if the family choose to give up the patients due to financial difficulties. Should the doctor still insist on treating the patients just because he could be potentially saved with an expensive surgery that his family cannot afford? Like bad debt is a realistic problem for the hospital. Leaving these patients alone with no assistance until he reaches the criteria of euthanasia is not moral as well. And this interest conflict cannot be easily settled down. A study conducted by J. Pierre in 2012 named legalizing euthanasia or assisted suicide the illusion of safeguard and control shows that 32% of the assisted deaths in Belgium are carried out without request, and 47% of assisted deaths go unreported in the Flanders region of Belgium. In this case, hope is care may be a better way to give life dignity. Or just think about it emotionally. The original intention of euthanasia is to end the patient's life comfortably and give their family out of the plight. However, a long eligibility reviewing process is inevitable, right? And it's hard to imagine how the patient and his family will be tortured in this period of time. Are you willing to count down life for yourself or your loved ones? That will be too crucial for me. The idealism today that only concerned about the concept, not the reality, will finally lead to the chaos in the society tomorrow.